You know that smell of nail polish remover? That familiar smell is very similar to keto breath. Along with that smell might come a metallic taste in your mouth. Keto breath? Yes, it's a thing. Let's talk about what keto breath is and what you can do about it if you have it. Coming up.
They're back. ProCare Health's customer favorite calcium dark chocolate bars are now available online at procarenow.com. Creamy chocolate plus calcium and vitamin D. You'll love them. Use code Susan10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell. You're listening to the Bariatric Surgery Success podcast, episode number 72. Most of my career, I've worked in some type of media, mostly radio, where I did morning drive spots over 18 years. That's actually how I learned a podcast. Ultimately, it led me to you. I created Bariatric Surgery Success to provide you with life-changing information, always based on science, trying to give you simple tools and strategies so that you are successful your entire journey. I'm happy you've connected with me. You're in the right place. I'm glad you're listening. In the newsletter this week is a link to my new holiday freebie. It's a festive meal plan, complete with appetizer, entree, side, and dessert, plus the recipes and color photos of the recipes. It will be available now through the end of December. So if you're not receiving the weekly Breaking Down Nutrition newsletter, it's a quick way to find out what's going on in the bariatric nutrition world, from new freebies like this one, upcoming courses, tips, product discounts, and always the latest podcast episode. So be sure and sign up at the bottom of my homepage, and that's always breakingdownnutrition.com. Okay, moving on. Have you recently had bariatric surgery and now you have this terrible metallic taste in your mouth? Does brushing your teeth help for a little while and then that bad taste returns? Does your breath smell like nail polish remover? You may have keto breath. Okay, the good news right up front is that it will go away. Here's what you need to know now about keto breath and what you can do about it. The most common causes of bad breath are dehydration, ketosis from rapid weight loss, which we'll talk about in a minute, and that's ultimately keto breath, dental issues, and food not emptying your pouch well. So let's start with dehydration, as it's a big factor in bad breath. It's easy to cut back on fluids, isn't it? After surgery, you don't mean to because you're having to take smaller sips and there's less fluid in your mouth, keeping it fresh. So for many reasons, and bad breath just being one, take note of how much water and other fluids you drink each day. So just as a reminder, you'll slowly be working your way up to 8 to 12 cups a day, or that's equivalent to 2, almost 3 liters of water and other liquids. You'll start with those small sips every 15 minutes as tolerated, and then build from there. So besides bad breath from dehydration, did you know that dehydration is the main reason for rehospitalization after surgery? That's why fluids are so important to start your journey off right and keep it on the right track. So sometimes bad breath can be resolved just by making sure you drink enough. If you think there's any chance you might have tooth decay or gum disease or any other dental issues, visit your dentist to rule this out. These types of issues can be an underlying cause of bad breath. So try to brush, even floss, after each meal or snack, whether it's liquid or solid, because both can cause bad breath. Even brush your tongue, as bacteria and food particles build up on the surface, and these can cause bad breath. Now, let's get to keto breath as a cause of bad breath. What is keto breath? Basically, when you reduce carbs to a very low level, the lack of carbs fueling your cell metabolism, that's meaning there's a lack of energy to your cells, your body will turn to stored fat as an energy source and break it down. So when your body breaks down fat for energy instead of carbs, it converts the fatty acids into chemicals called ketones. The body has numerous self-regulating processes whose goal is to maintain a balance of its internal environment. So with the increased production of ketones, the body will get rid of these through both your breath or respiration and urine. One type of ketone, acetone, is an ingredient in some nail polish removers, which is why your breath may smell like it. So when you hear the words keto breath, they refer to the release of those ketones, which is the breakdown of stored fat in your body when there's a lack of carbohydrate for fuel. And it can also give you a metallic taste in your mouth. Keto breath can happen to anyone who loses weight, but it's more noticeable after weight loss surgery because of how fast the weight comes off. How do you get rid of it? As you move along your journey and you start to add more carbs back to your food intake, keto breath should go away. So speak to your bariatric dietitian about it if it's just such a problem you can't stand it. Sometimes adding back as few as 5 grams of carbs can make a difference. Eating foods that increase saliva production, like parsley, celery, lemon, or grapefruit, can help a little with this bad breath too while you're going through this period. A less common problem, but one I want to make sure that I mention, is bad breath after lap band or gastric sleeve surgery. It can be caused by food that isn't emptying the stomach pouch as it should. So the result is a buildup of digested fluids such as acid in the stomach pouch. And this buildup can put you at an increased risk for acid reflux. This often shows up as what? Heartburn or regurgitation. The main reasons that food becomes stuck in the pouch is eating foods that are not recommended after the weight loss surgery or eating too quickly. So if you're drinking plenty of water, plenty of fluids every day, you have good oral hygiene, and slowly adding carbs as you're allowed to has diminished that keto breath, and you still have a bad breath issue, then you might want to talk to your healthcare team just to be sure all is okay. I hear you. Keto breath is not fun to deal with, right? When you're trying to make all these other changes after surgery, but it will go away. Remember, it's the very low carb diet that causes it. So as you start to add back even small amounts of carb to your diet, it should correct itself. In the meantime, try some of that little parsley, little lemon, little grapefruit. Just in the mouth will increase that saliva production and help a lot of times with that bad breath. Take care of yourself. Be good to you. You're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.